everyone, this is Dr. D. Terrence Foster. Let me take this opportunity to say welcome to you if this is the first time that you're joining me on my YouTube channel. Now, today I'm going to be talking about 8 simple things that we all can do that will save our lives from the coronavirus COVID-19. Now, these things that I'm going to talk about are not things that you have not heard about. You've heard about them, but what I've done, I've packaged it in a way that will simplify it and make it easier for people to remember it in general. Because sometimes so many things are just floating around, flying over our heads, and people tend not to remember or can process so many things. So this is a simplified way of remembering these things that are so important. Now, I put them in a plan that is called Ms.WIGAT'S plan, W-I-G-A-T-S. That is Ms.WIGAT'S plan. And you're wondering, well, who is Ms. WIGAT or why Ms. WIGAT? Well, this is something that I have created and you'll find it very useful. Alright, but before I get into Ms. WIGAT'S plan, let me just get rid of COVID. I like that. I wish it was that easy and that simple. However, ladies and gentlemen, COVID, the coronavirus, is going to be with us for a while. And we got to find ways and different means of dealing with it. So this is one way that I hope will be helpful. Now, the first letter of Ms. WIGAT is the letter M. And M stands for mask. And we've heard so many times everyone should wear a mask. It's so important. And why should anyone wear a mask? Well, what a mask does is that it prevents the transmission of infection from those that are infected to those that are non-infected. In other words, if you have the infection and you're wearing the mask, then it will significantly reduce the risk of you passing on that infection to those that are not infected. Now, it's quite obvious that if you have symptoms, you're symptomatic, meaning you have a cough, you have fever, or you have other symptoms that are commonly associated with coronavirus, then you know that you are probably positive, and maybe you've had a positive test. So you know that you should wear a mask, and that's quite straightforward. Now, what is not so obvious is for those that do have the infection but have no knowledge that they have the infection. In other words, they're what we call asymptomatic carriers or silent carriers, and they also could pass the infection on to those that are not infected. So the fact that there are people, anyone who could be asymptomatic carriers, it means that all of us, those that have no symptoms, those that have symptoms, should all wear a mask. Now, sometimes there's some confusion with people who said, well, you know what, I've just had a negative test. I've been tested for the coronavirus and I'm negative, and therefore I don't think I need to wear a mask. Well, you know, that's a little bit selfish in some respect, because guess what? Even though you've just had a negative test, the moment you step out of that clinic or that facility that has just tested you, you could come into someone and be infected right there and then again. You know, so right there and there for the first time if you've never been infected. So having a negative test doesn't mean that you will not be positive in the future. In addition, imagine this. Imagine you're standing in front of someone who is spewing out secretions of virus coming out in large droplets or aerosolized secretion that are infected, and those are coming right at you, hitting you in your eyes, your nose, and your mouth. And you know where those are going? Those are going to go right into your respiratory system. Now imagine also that you have a mask that covers your mouth and your nose. You could see that that is definitely going to give you some protection and reduce the amount of virus that possibly will get into your system. In other words, it's going to reduce what is called the viral load. So you have less virus getting into your system, and therefore less chance of you having or contracting the infection. So the mask also has a protective benefit of helping or preventing those that are not infected from becoming infected. So that's another reason for you to wear a mask. Therefore, everyone should and must wear a mask. So that is pretty clear. Now, in addition with masks, there's some other things associated with facial protection. The eyes is another route where the virus can get in, as well as your nose and your mouth. We're very familiar with the nose and the mouth. Those are the two main entrances, but the eyes is a third entrance as well. So it means that the use of goggles are important in protecting or reducing the risk of infection. Now, this becomes even more so if you're in line or on the front line, whether you're an healthcare provider or you're a cashier or someone who is constantly dealing with a lot of people, then it means that you are more likely to be affected by the virus affecting your eyes than say someone who is casually who's not constantly dealing with the public or people in general. Therefore, their risk is not as great. But goggles can be a very important arsenal as part of your protective equipment. In addition, face shield. Face shield is very common and very useful because it provides protection for the face, for most of your face. You basically put it on like this and you're good for a while. It provides some protection. Another form of protection for the face and in general is barriers. Barriers are commonly seen or should be seen like in counters, like in cashier counters or ticket agents. You will see barriers, or they should be there, that will help to prevent infected person from transmitting the virus to the person behind the counter or vice versa. So barriers are very important. So the letter M is the first letter in Ms.WIGAT'S plan, and mask is a defining object in that segment. The next one is the letter S, and S stands in this case for social caution, for safe distance. Now, generally this is defined as about 6 feet or more. If you're essentially at 6 feet or more, then that is considered to be a safe distance. And this came about because there have been many studies which show that 6 feet is about the point where most people would be safe from contracting the virus from someone who is 6 feet away. However, there are studies that have shown that you could be safe even up to 3 feet. And there are other studies that have shown that you may need to be as far away as 13 or 20 plus feet in order to be safe. So there are a range of studies, but in general, the studies that most people look at are those that are within 6 feet that has been shown to be effective in providing protection. Now, why is this important? What happens is that when someone coughs or sneezes or laughs or anything that projects or spew out secretion, then that person or those secretion will come out in the form of large droplets or aerosolized secretion. Now, large droplets will tend to fall anywhere from 3 to 6 feet, or sometimes a little further, but typically because of gravity and their size, they will tend to fall very quickly. Whereas aerosolized particles or secretion, they will tend to hang around in the air for a much longer period of time. And what this means, if you're in an area that is poorly ventilated, then chances are there's a large amount of aerosolized secretion, then you're more likely to get infected because of poor ventilation and a large concentration of the viral load that is there. Therefore, it's important to be in large areas that is well ventilated in order to decrease the risk of infection. If there are a lot of people that are coughing, laughing, or talking, because then those secretion cumulatively could lead to a large amount of viral load and a large risk of infection, or at least to the very least an increase of infection. So the next letter in Ms.WIGAT'S plan is the letter W, and W is fairly simple and very straightforward. It is washing our hands. Now, we're all familiar with that. The problem is that most people do not wash their hands long enough. You should wash your hands for at least 20 seconds. We should also wash our hands frequently. Now, usually soap and water is adequate enough to wash our hands, so we don't have to get too fancy about that. Good old soap and water is good enough. If for whatever reason you don't have soap and water, then you could use an alcohol-based sanitizer, and that could be very useful as well. The next letter in Ms.WIGAT'S plan is the letter I. It's for infection control. Infection control is very important, and it consists of 1, cleaning, that's general cleaning, sanitizing, and disinfection as well as decontamination. Generally, for the most part, we will not have to deal with decontamination. Decontamination is what you'd see, for example, on the street in China, where people are spraying all sort of chemical in very sophisticated personal protective equipment, and we don't know what they're spraying or why they're spraying, but we're seeing they're doing that. That's what decontamination often looks like in part. Now, what we'll most likely be dealing with is sanitizing and disinfection. Sanitizing is not the same as disinfection. When you're sanitizing, you're essentially doing a much deeper cleaning, and you're using chemicals to clean. You may get some bugs killed, but for most of the killing you will need to be disinfecting, and by that you'll have to pay close attention. And paying close attention means that you gotta look and see what the labels of the chemical that you're using to ensure that they are going to do what you're trying to get done. There's no point in you getting out and cleaning with cloths and using chemical and not knowing what is it you're cleaning. So it's very important that you take the time to use or to pay attention to make sure that the chemical you're using is what is important. Now, what happens after you finish sanitizing and disinfecting? Then the next thing is once you're aware of what needs to be done, then the question is, what do you or where do you disinfect and sanitize? You disinfect the common areas such as your doorknob, countertop, and any area that you think may have been infected by the virus or any sort of bugs. Now, also, if you operate a facility that see either massage therapist, hairdresser, barber, or medical clinics, therapy clinics such as physical therapy, occupational therapy clinic, then those areas should be cleaned before the next patient comes in to reduce the possible risk of infection. So it's very important that you always are sanitizing, cleaning, and disinfecting those areas as needed. So after infection in Ms.WIGAT'S plan, the next thing is gloves. Gloves are very important and become an indispensable part of our protective equipment. However, gloves can be and often is a double-edged sword, meaning that there's increased risk of cross-contamination. The reason for that is that people tend to go from place to place, holding different objects, touching different objects, without paying attention to what they're doing and without realizing that they've been wearing this gloves or that pair of gloves for several hours. People sometimes get up and go home with their gloves. Now, that is bad, and that's a risk for contamination and for spreading infection. So be aware of that. The key factor there is awareness and changing your gloves as frequently as necessary. Now, also coming along with gloves are other protective gear such as headwear, gowns, lab coat or coat, as well as shoe cover. Those are also part of protecting the body. Now, of course, not everyone will need all of this. Each one will have to, literally, depending on your line of work, your role in your endeavors, determine what, if any of these is important. Some of them, of course, will be important or more important to others than other people. So make sure you could just analyze this and see, based on what your role is, your job, your work, your mode of transportation, all these factors should be considered in determining which of these you take and which of these you apply to your own life situation. So it's important to realize that. The other thing about gloves and gowns and all these things is it's easy to get on. The next part of them is taking off. And when you're taking off, that is a high risk venture, meaning that there's an elevated risk of you getting contaminated or you getting infected by the same virus or bug that you're trying to avoid. So be aware of that. Make sure that when you're removing your clothes, your gloves, that you're not necessarily picking up the infection. And also make sure that you're not taking home these things to your own environment or to your family members, so that they also are protected as well. So it's important to bear those things in mind. One of the things that I've noticed recently in our facility, I saw my physician assistant has her phone in a Ziploc bag, and we've talked about, of course, very simple. What this does, because we use so many gloves, this protects or reduces the amount or of any bugs getting, or any germs, dirt getting onto our phone during our level of activities in our office. This you could also use in addition to a Ziploc bag, you could use a plastic wrap or a cellophane wrap. That will also give you some added protection for like your cell phone, because what happens sometimes when we're on the move, when we're running, if our phone rings, we just grab it and answer without even thinking about it. So this will give you some protection, but again, be careful of unwrapping your phone because you could pick up some infection from there as well. This I give credit to my physician assistant for pointing that out to us. So the next after glove, the next thing in the line of Ms.WIGAT'S plan is the letter A, and A is very simple. We should avoid touching our face. Sometimes we touch our face, and when we do that, we are providing an access for infection to get into our eyes, or our nose, or our mouth. So simply avoiding that, particularly when our hands are dirty, which is probably most of the time. So we want to be sure that, again, it sort of goes back to W, which is washing our hands, and we should wash our hands frequently. When our hands are clean, we could touch our clean face. So make sure that we avoid touching our face. That's the letter A in Ms.WIGAT'S plan. Then the next letter in Ms.WIGAT'S plan is the letter T. T stands for testing and contact tracing. Now, the important part of this is testing is so important. We keep saying that over and over, because when we test, we know who is infected and we know who is not. Even though sometimes testing has some limitation as well. That's another video sometime. But here's the point about testing and contact tracing. If for whatever reason you as an individual believe that you may have been exposed to someone who has the virus, or you have symptom, whether it be symptom similar to what the coronavirus is, then make sure that the first thing you do is to isolate yourself. Once you've isolated yourself, and you should do this whether or not you have been exposed and you're asymptomatic, or you have been exposed and you have symptom, or you just developed symptom and don't know where the heck it came from, but you have symptom. Isolate yourself. Once you've isolated yourself, then the next thing is to try to get tested. How do you do that? The first person or people you contact would be your primary care doctor, or whichever doctor is taking care of you. If you don't have a doctor, then the next step then is to contact the authorities and let them know that you have potentially been exposed, and describe the situation, and then try to get tested from there. Now let's assume that happens and you do get tested and you turn out to be positive. Then the next role that you have to play in this is you're going to have to try to provide the authorities with information about where have you been, who have you been with, and where are those people that you've been with, because that is going to give them a chance to figure out, well, who should we test next? Who should we test next? Who should we try to figure out where they've been and who they've been with and who has a positive test? This is so crucial and so critical. And the reason why it's like that is because we do not have a sophisticated enough system at this stage in most countries to determine who has been where and who has been with whom. Now that seems pretty invasive, but that's the only system that would have to have in order to determine who has been where and who has been their contacts. So right now, each person is the main source of information to the authorities and telling them where they've been and who they've been with, because that's the best way we have for doing surveillance now in terms of helping to curb the coronavirus. So make sure that you are part of the system. One thing you don't want to do is don't just sit and hide away, don't run and hide, and don't believe that, okay, this thing is going to go away. If you really genuinely believe that you are infected or you've been exposed, make sure that you get tested and follow the instruction as I described. Now, one other thing that I must mention in this general category of getting tested and contact tracing, when someone, and this is for general consumption, when someone has been positive with the coronavirus, sometimes it can be a scary experience, particularly for those that are around that person. And let me just remind all of us is that we should still be respectful and treat that person who has been tested positive with respect and dignity, because you know what? Any of us at any time could be positive with the coronavirus, and would like to be treated fairly and decently, with respect and with dignity. So be kind to someone or anyone who has been tested positive with the coronavirus. It's so important that we're able to do that. Now, the final thing in Ms. WIGAT'S plan is the letter S. And S simply means stay at home or shelter in place. Now, this is very, very important, but this is something that's usually instituted or effected by your country, your state, your governing body, wherever you are living, in whatever country, whatever state. You will know whether the authority, or you should know, or try to find out whether the authority has a stay in place order. If it does, then your responsibility, of course, is to obey that order. Now, because why do you want to do that? Because stay in place, shelter in, allows for the virus to die a natural death. Within 2 to 3 weeks, the virus is likely going to die a natural death. So staying in place will allow that. Now, a critical thing about staying in place, particularly with family, is that if you have a family that is staying in place or shutting, this applies to every single member of the family, adult and children. Everyone has to be a part of it. You can't have some running out and doing whatever they want to while the others are staying and trying their very best to be safe. So bear that in mind and let it be a family or a total community effort. Community start with the family, but the family should all stick together and everyone should be doing the same thing. Now, so we've gone through Ms. WIGAT'S plan. The first letter, of course, is the letter M. We talk about primarily driven by mass. The second letter is safe. The letter S, safe, distance. The third letter is W, and W for washing our hands. And then the next letter, high, for infection control. And then G for gloves or gown, and those are all other equipment that we wear. And after G comes the letter A for avoid touching our face. And then after A comes the letter T for testing and contact tracing. And then finally the letter S for staying at home or shelter in place. Now, those are very important, and it's outlined in a way that you can remember it if you simply remember Ms. WIGAT'S plan. Now, this is important. I think can be really very beneficial to so many people. I know a lot of people may not see this, but if you do, please remember to share it, pass it on, so that other people can benefit from this as well. If you find this to be beneficial, don't forget to like it, again, share it as I just said, and remember to subscribe to the channel. I want to take this opportunity to say thank you so much for watching and paying attention to what I'm saying. And we will continue to make videos of this and other interesting subjects. Always check the description of the video that we produce. Sometimes there's additional information in there. Some things when we do these videos, we try to keep them short, but as a medical video, sometimes it's extremely difficult to keep them short because there's so many things that need explanation and additional verbiage so that you could have a better understanding. But again, thank you for watching. Remain safe and take care of yourself. Bye-bye.